Hi friends, I am Dr. Ashutosh Gupta, and today we are going to talk about some unusual findings in the fetus that puts the baby at risk. So whenever we are doing the ultrasound, specifically the anomaly scan, which we usually do at 19 weeks, so we do sort of a detailed and we dive deep into the ultrasound so as to identify each and everything about the fetus, so as to ascertain that is everything fine with my baby. But sometimes we identify some unusual findings which might put the fetus at risk, right? At risk meaning thereby that there could be a finite risk of an IUFD in utero or when the baby is in the mother's womb. So one of the findings is called as an umbilical vein varix, right? So umbilical vein takes the oxygenated blood and the nutrition from the mother to the baby, and therefore it inserts into the umbilicus. But whenever we identified that there could be some dilatation in the wall, so the wall has got some sort of a dilatation, and as soon as it is entering into the fetal abdomen, and therefore there could be a dilatation, and which is called as an umbilical vein varix, right? So we have got a very good case. So I'll just demonstrate that umbilical vein varix and how sinister it can be. So this is one case, and so you look carefully. This is at 19 weeks. We are doing an anomaly scan. So as soon as the umbilical cord is inserting into the abdomen, there is a saccular, hypervascular, spherical, hypervascular sort of a dilatation, which is very hypervascular. So this is an umbilical vein varix. Now we do have our own criteria by which we identify and delineate, but probably you try to look around the hypervascularity and the turbulence, right? So this is the turbulence which is happening, swirl pool types, and this is the pictorial diagram. How does it look like? Because of the some thinning in the wall or the deficiency in the wall of the umbilical vein, when it enters into the fetal abdomen, there could be intra-abdominal part of the umbilical vein gets dilated, which is called as an sort of an umbilical vein varix. Now it has to be greater than 9 millimeters or should be 50% more than the distal umbilical vein when it is getting into the liver and all those stuff. So if both of these criteria are being met, we identify it to be pathognomic. So at this stage it was only 6.1 millimeters, so it was not that sinister. But the thing is this, that we are identifying this at 19 weeks. So still we are left with 19 more weeks to travel before we would have a baby or we can deliver the baby, right? And then this point becomes a sort of a nodal point, so as to have the turbulence and to have a whirlpool type of movement of the sort of a blood, and therefore this becomes a nodus, this becomes a nodal point to make a thrombus, right? This sort of a dilatation, it can be saccular, spherical, and tubular. So tubular meaning thereby that we keep the baby under surveillance and identify if the tubular is there. Tubular meaning thereby tube-like, so which is more benign types. If it is saccular or spherical, it is slightly, it has got more potential to make a bhavar type, a whirlpool type of movement in the blood, and when it is entering into the fetus, and therefore the thrombus gets formed, and therefore we can have some complications to the baby. So this is how we sort of an, so meaning thereby that it is not that we do the ultrasounds very early and all those stuff. So we usually tell them that this could be the risk, and let the baby be in a surveillance, and then we keep the baby under surveillance as far as the ultrasound is concerned, so as to identify there is a rapid dilatation or rapid movement. If it is not there, then we follow it out across, and then we deliver the baby at term. The only thing to be looked around for is as the baby is born, we put the umbilical, there is usually a tendency of putting up a clamp onto the umbilical cord. So the umbilical cord, the clamp has to be put something around very far off, slightly far off. It is not to the just at the side of the umbilicus. So that might even sort of an injure that umbilical vein varix which is there. Gradually it is going to subside as the baby is concerned, but probably immediately after the baby is born, there could be finite risk that this might even get injured and rupture can be there, and therefore it could lead to catastrophe, right? So when the baby is born, the umbilical cord clamping has to be done slightly far off into the umbilical cord so that the stump, so we do have a big stump, right? So this is how one single finding of an umbilical varix can really change our sort of an scenario, right? Thank you very much for your patient listening.